Welcome to Beyond the Surface. With me, Debbie Anne Turnbull. Here we dive deeper than the obvious to explore what really keeps our families safe and our minds strong. After losing my only son Chris to drowning, I've dedicated my life to water safety education and helping others heal. With many years of training and personal experience, I'm here to help you navigate your challenges, because the most important truths are found beyond the surface. I am so pleased to bring on an amazing gentleman who I met in the early days, really early on, and it was Steve Wills. And back then, Steve was actually beach safety manager for the RNLI. Well, obviously, things have changed for both of us, Steve, and we've both progressed in a big way. And tell us, Steve, what you did at the time. If you remember, we met at the first event that I did in Llandudno. And just tell us that story and what you were doing then, and maybe how that affected you, what we actually put together that first time.
Yeah, sure. Well, thanks first off for allowing me to be part of your podcast. It's much appreciated. And yeah, I can't believe it's 20 years since we first met. Unfortunately, sadly, in the situation it was. But my role at the time was with the Royal National Lifeboats Institution, as you say, running our sort of beach safety work. That was quite a new initiative. The RNLI had already started setting up lifeguards back then, which was still fairly new. But we also wanted to make sure, beyond the kind of lifeguards themselves on the beach, that we also did a lot of work on education and prevention around people in trouble around the beaches of the UK and Ireland. So my role was really to sort of establish a number of initiatives to help raise awareness of some of the risks around the beach and more generally water safety, and then designing a number of programs to help reduce those drowning rates. So things like beach safety signage, school education programs, public awareness campaigns, that kind of stuff. And some of that stuff is still going, which is brilliant. So
Yes.
but as you say, I've sort of moved on in different roles within drowning prevention, but still very much in the same kind of space. So that's kind of where I was at the time.
Yeah. And I mean, that event was, to me, it was everything. I remember, I know at that time I had no money whatsoever, no grants or anything like that. And I think I started off by getting an Arctic truck on Llandudno front with a Britain's Got Talent guy, a finalist. And we just all kind of came together. And to me, it was just wonderful that people like yourself came down from head office and actually made that time to stay overnight. I think there were 5 or 6 of you from what I remember. There were grant funders there. And I just knew then that it was the start of something really special. Steve, tell us your journey from that to kind of where you are now and the amazing things that you've done. You're working with the WHO and you're doing some incredible work. So tell us how you've grown.
Sure. Well, I mean, likewise, I remember that that day very well in Llandudno, for a number of reasons. Obviously, meeting yourself and learning about the tragic situation that resulted in us coming together. But I still remember clearly the people I met there, and it was sort of a bit of a kind of catalyst for me, I suppose. It was one of the first opportunities I kind of got to understand a bit more about some of the kind of reasons and issues behind drownings, and sort of meeting people who've been directly impacted by it. So it was definitely a profound moment for me, and landed there, particularly in the area where Chris sadly drowned. It's sort of my dad was from Llandudno, my gran, my aunts actually lived quite close to where the tragic incident happened. So it was all sort of yeah, it was an interesting time, but it was certainly a kind of formative part of my learning, and hopefully, it's helped me think about how we do things and how we hopefully prevent things like that happening in the future. But in terms of my career, I suppose I stayed in that role for a few years. Then I moved across within the RNLI to help set up our international work. So the RNLI at that time hadn't really engaged formally internationally, although it had lots of
Mhm.
relationships with different international life-saving and drowning prevention organizations. But we wanted to really establish the RNLI as a kind of global entity in terms of doing some great work, working with governments, local organizations, NGOs that help develop their capacity to also reduce drowning, learning from some of the things that we've done in the UK and Ireland. But equally, what I found is I was learning far more back. So I was learning different ways that we can reduce drowning and different kind of innovative approaches, particularly where there isn't much resource, but you can still have a great impact. So that's kind of how it started. And over that sort of 10 years, when I was sort of involved with our international work and sort of leading the setup of that program, we managed to sort of work closely with the UN agencies for the first time to really get drowning on the global agenda, because at that time, really, was very little happening around drowning
Yeah.
prevention,
Yeah.
even though it was claiming hundreds of thousands of lives every year, particularly children and young people, and particularly people in sort of poorer parts of the world. So there was certainly a massive gap there that we felt that we could add some value to. But really, our role, I suppose, to sum up in that part of my journey was to kind of grow the momentum and kind of bring more people into the mix, because the RNLI on its own can clearly address this challenge. So we wanted to bring other big sort of NGOs, other life-saving bodies, the UN, really into the kind of into the mix. And that really resulted in things like UN General Assembly resolutions for drowning prevention, World Health Assembly resolutions. So really getting on the
Mhm.
global political agenda to raise that profile of drowning prevention. And then, more money, more resources, more political clout, I suppose, around the issue, as well as all the amazing programs on the ground to really reduce those drowning rates. And then earlier this year, I decided it was time to move on and try some other things. So still very much firmly in the drowning prevention world. I haven't moved from that.
Mhm.
It's my passion. It's what I know, probably all I know, to be honest. So it wouldn't be much good now trying to do something completely different. So I'm now gone sort of as a consultant freelance. So I'm doing work for a number of organizations, mainly the International Maritime Rescue Federation, which is a kind of global body for representing maritime search and rescue
Mhm.
organizations. We're a consultative member of the International Maritime Organization, which is a UN agency. So doing lots of great work to kind of improve search and rescue. I've also done some work with the Bloomberg team on their programs in Uganda. I've also been supporting some of the World Health Organization initiatives to sort of raise the profile of drowning prevention and kind of support governments into taking action following the great things like the UN resolution. That needs
Mhm.
to actually materialize now into action on the ground. So it's now supporting governments to really think about how they translate, what is quite a dry document, but how to actually turn that into some real action on the ground. So that's currently kind of what I'm doing, as well as sort of non-work related stuff. But that's my main thrust at the moment.
And how do you feel about from 2006? How do you feel that education has grown and moved forward since then? I mean, we've got things like the UK drowning prevention strategy. We've got the Wales strategy. We've got a Scotland one now. Um, I personally think they're amazing, and I'm really proud to have been there at the start of all of that. Um, and we've got things like Water Safety Wales now, which I'm just becoming a partner of, and so proud. But things like that, Steve, they should have been there a long time ago, shouldn't they? Really?
They should have done, and it's great, as you say, that some great work has been done to really mobilize these different organizations and also to kind of coordinate much more, because before, perhaps when I was starting, everyone was very much in their own lane doing their own
Yeah.
thing, and there's very little kind of cross organizational working. I think that has definitely improved and sort of been transformed, and these bodies that you refer to are, that's what they're there for. I
Yeah.
think the frustration that you and probably I still have is we need to make sure those things then deliver and actually
Mm.
do things. Because to me, whether it's a UN resolution or a national body like the National Water Safety Forum or whoever, until action happens on the ground as a result of those things, nothing's actually changed. People are still
Yeah.
at risk, and things don't actually happen to kind of prevent or respond to a drowning incident. So there is some amazing work going on, but there's also still quite a lot of challenges, political challenges at the moment, funding challenges are all hampering efforts to progress the issue. Swimming pools closing down, not
Mm.
getting water safety really enough on the curriculum, still a big gap. So probably, good work going on, but clearly a lot
Mm.
more still to be done, which is why
A
you and
lot.
I do what we do. Yeah.
Mm. I think as well, things like the Swim Safe program. Everyone to me should be doing that, because I was there. I was at the launch of it, and I worked with Chris Cousins then at the time. We launched it here a number of years ago, and to see the faces of those kids that have been through that program. And then at my event that I did in partnership with the fire and rescue, again, to see them, they were learning, but they were full of enthusiasm. And I just think that should be available to everybody. It really should, or in some form or format that we could do something. Um, I know that locally here, the fire and rescue are actually doing a pilot program, if you like, with Swim Safe, so that we're getting pool education and water safety education now, which I'm really looking forward to. But again, it's a numbers game, isn't it? As we well know. Like you say, pools are closing down, not enough availability of pool time, and cost. And it just seems like 10 steps forward and 5 back, doesn't it? That, it's just a nightmare sometimes. And I also think the funding as well. There should be more funding for all of this. It shouldn't be down to people like me to do what I do. I mean, I fund myself if I've got to, but it shouldn't be like that, should it? I think more work needs to be done there, definitely. And I'm not saying it to get money out of anyone. I'm just saying it's part of the course, isn't it?
Yeah, no, I agree. And swimming and swim skills, particularly at the sort of survival level rather than sort of competitive swimming, is the kind of vaccine against drowning. It's
Mm,
the kind of, one of the most proven and highly effective solutions there are for reducing drowning. It's a skill you can't really unlearn. So once you've been taught
mm,
it, that knowledge retains for life, essentially. So it's such a vital skill. And of course, it provides much more than just reducing drowning. It has lots of health and social benefits. So there's lots of additional benefits to some of these programs. I think that might be one of the areas where we're not, as a community, that good at, is actually talking about the
mm,
kind of additional benefits of some of our initiatives, because we're very focused on drowning prevention, quite rightly,
yeah,
but if we want funding and want to engage government, we need to talk about the kind of co-benefits of a lot of these interventions, and then people may listen. And of course, in the UK particularly, there's a huge inequality with certain groups of people not having
yeah,
access to swimming, and then they're at much higher risk of drowning. And how can we break some of those
absolutely.
barriers down?
Yeah.
And I think that's where we can start to really, make some inroads in terms
Mm,
of those conversations. But yeah, it's a huge gap. When you look at the size of the population, the group that really needs to be taught these skills, it's a huge challenge. So I suppose the other thing I would add is, if there is limited resources, how do we target those most at risk? So if there is limited
mm,
funds, we need to make sure that goes to the right people and not just to those perhaps that wouldn't overly benefit from some of these
yeah.
initiatives.
I'm looking at the moment at doing some form of storytelling. I was speaking to Chris Cousins this week, and what I'm looking to do is get people that have been rescued to tell their stories from when they were in the situation needing to be rescued to actually coming away from that and what they've learned, because there's nothing better than a story, is there? I back up everything that I do when I'm teaching to say, I've got a story for this. I've always got 10 stories now after all these years. But I think if we did more storytelling, and I think also it there is a lot more, like you say, to learning to swim on the benefits of it, but there's a lot of benefits for feeling safe
Mm.
when you're doing that as well. And I think if we could encourage more of that, especially with things like mental health and all that kind of thing, or feel, general wellness. Maybe if we worked on things like that to then go to funders and say, look, this is the bigger picture, because it seems to me to be quite static in
Mm.
that you learn to swim just because you've got to, but what about a bit more why, you know?
Yeah, no, I agree. And I think talking about the sort of having the voices of those that are impacted by some of these issues is certainly a really powerful tool for having those
Mm,
conversations. So rather than people like myself banging on about this all the time, getting people like yourselves and others who have have been
mm,
directly impacted by this issue is far more powerful in many situations.
mm.
I remember some of the work we're doing with the UN. We were trying to advocate for these resolutions, which is a very political kind of process in New
Yeah.
York and Geneva. And, we did a lot of great stuff, but actually it's only when we got people that had really been impacted, particularly from countries where there's a high prevalence of drowning, talking about their own situation where their children had drowned. That was when we
Mm,
really got the attention of the policymakers to really know this is a real issue. It wasn't just a kind of abstract thing that we were talking about. It's something that impacts thousands of people, and not just those families, but whole communities around those
yeah,
people.
it
So
is.
yeah, I think using the right voices and the right situations is probably again something we're starting to do in this country, but something we probably need to do a lot more to get that attention,
Mm,
and then do what you said, which is then to talk about those other benefits and other advantages of some of
yeah,
these
yeah.
initiatives.
I
And it's
think we
not
better have a chat.
exactly. It sounds like we do. Yeah, it's been a while, but
I
yeah,
know.
there is. I think. I mean, you said a minute ago it's sort of 10 steps forward and 5 steps back. To me, that's still progress because obviously you're still making some
Mhm.
headway with
Yes.
that kind of ratio.
Yeah.
But it is frustrating when you do have those 5 steps back,
Mhm.
quite regularly. But I mean, I always try and look at things in a fairly positive way. And I think there is some, as you highlighted, some great forums that have been set up in the UK within each devolved nation, but also overall. Some great work going on within government in London as well to push this
Yeah.
issue forward. There's some new organisations now, things like the Black Swimming Association, others that are really getting
Mhm.
focused on this issue. The work the RNLI is doing, obviously, and all those other organisations, there's definitely progress, but it's now how do we get the momentum to get the scale to get the
Yeah.
real numbers down? Because at the moment it's quite sort of piecemeal and project-based stuff, which is brilliant
That's
to
right.
prove something works. But then how do we get it to the masses of people that actually
Mm.
need it, like curriculums or access to, swimming on a wide scale? So I think that's where the current challenges against a backdrop of less money, political instability, all sorts of things going on globally that really is making it difficult to move this forward. But it's progress has been made.
Oh, it is. But I do think also with the school education, from what over the years I've gleaned, if you like, is that even if you've got a program that's really good and it goes to schools and it's free, doesn't mean they're going to do anything about it. Because if
No.
they don't think it's necessary, they ain't going to do anything with it. Because I know from going in schools, I've gone in, and then as I've learnt how I want to develop my work, I'm putting my own other courses together now. But if you don't follow up, they say in sales, the fortune is in the follow up. And if you don't follow up and say, have they done the homework? Have they done the posters? Now, I mean, I've got hundreds and hundreds of posters that children of 8, 9, 10 delighted in making. And what it does to me is if I've stood there for 40 minutes and then given the class homework to do and said, look, will you ask them to create a poster? And I'm talking up to 11 years old here. Even the first year in senior schools, they've been excited about doing it. And I always remember in one session I did, we were talking about peer pressure, and you've got to be careful how you do that, obviously. But I addressed it, and we gave everyone a big piece of A3 paper. They did what they did, and it worked out that 60% of those kids wrote and drew about peer pressure, and it's just for me, it's a simple thing, a big piece of paper and some colouring pens that it tell you can actually see. I've got posters, Steve, where I've got pictures. It looks like Capel Keurig because of how I've described it. And they even put a little coffin. I don't mind because what I see there is what they've learned within 40 minutes. But I
Yeah.
still think in any education program, we need to do follow up somehow. And I know it's hard, but some schools just are not interested.
Yeah, then you're relying on, as you say, the engagement of individual teachers. There's not people like yourselves going, and you're relying on
Mm.
teachers who will have a different take on these things, and then the quality will vary as it would with anything. I mean, there is some work I know that RNLI and others have done looking at sort of measuring children's awareness levels before, during, and then, 6 months
Mhm.
after to see if they are retaining this
Yeah,
information, and then refining the messaging based on that. But I would
yeah,
still say, I mean, I go back to my school days, which was a very long time ago, but I still remember, the local policeman or local fire person coming in and talking to us about, crime or fire safety. And
yes,
I don't remember them being that particularly engaging, but I still remember the messages that
yeah.
they would putting out. It's a really powerful thing to have someone go
Mhm.
into school and talk about a particular issue. I think children do remember the key things, but as you say, it's how much do they remember? But I was thinking as you were speaking about all the other things perhaps that don't exist so much now that they did in the past. I remember, when I was a cub, we did the whole jumping in a swimming pool with your pajamas on and getting a brick from the
Yeah, yeah.
bottom. Not quite sure why we were wearing pajamas, but anyway, we did.
Mhm.
But all these things were just sort of built into,
Mm.
into the school or the kind of community programs. And I think
Mm.
perhaps where things like the water safety councils and others need to do is kind of align back with these youth organisations like the Duke Edinburgh Scheme, the Cubs, the Scouts,
Yes.
the
Yeah,
Guides,
I do.
because then you get the scale then through those. I know there is work going on in these areas, but it's making
Mm.
sure it's done in a coordinated and, as you say, kind of more evidence-based approach, or at least with an
Mm.
approach where that the majority of kids are learning something from these sessions.
And I mean, in one another session we did, it was in not this year, but 2 years ago. We did a session in Colwyn Bay, and we had things like a bowl, and we had a big Coke bottle. Other brands are appreciated, but we got them to use those for rescue, and then we did throw lines and I mean, it's the action, isn't it? They're not sat by a screen learning all day. They're getting out and feeling it and doing it, and making their minds work. And I think any of that stuff is so important. Like I say, and this is why I think I like Swim Safe so much. Steve, do you remember a lady called Rebecca Weir Robinson?
Yeah,
You
yeah, I
do.
do. From America, yeah, from the US, yeah.
She's kind of pulled away from it a bit now, but Rebecca Weir Robinson, she was amazing. She supported me for probably 11 years, and her work was absolutely incredible. And her catchphrase, if you like, was "A child drowns every minute across the world." And when you think of that, we've been speaking for 20 minutes or so. 20, 30 people have drowned, haven't they?
Yeah, in fact, when I used to do a lot more sort of engagement sort of presentations to people, I used to quite often end my presentation with that very fact, saying, in the 20
Mm.
minutes I've been talking to you about this issue, this many
Mm.
people have died. And it really got people,
Yes.
realizing it's not something that happens infrequently, it's happening
Yeah.
all the time. And obviously certain populations, younger people, children, are
Mm.
much higher risk within those numbers as well. So yeah, it's the numbers, I think people just don't quite understand it. And because the numbers are so big, sometimes it kind of loses the impact in some extent. So it's having, as you said earlier, sort of case studies and
Mm.
real stories about individual cases to bring it home, that the impact these incidents are happening. And it's up to
Mm.
me, it's unlike many other kind of health burdens in terms of, most things as a kind of prolonged periods of hospital
Mm.
involved. This is people normally going from the happiest moment to the saddest moment in a second. It's such a unusual sort of cause of death, I suppose, in some ways. And it's such a tragic thing. It's not after a long-born illness where perhaps, you know, there was an
Mm,
expectation something was going to happen. This is someone playing on a beach or by a river or wherever, and
mm,
then within a few seconds, it's turned into the entire family and wider network's most awful
yeah.
day ever. So it's
Mm,
yeah, it's only when you tell those stories or get people to tell those stories,
mm.
it brings it home to people.
And also, I already know that, I mean, people come here to commit suicide, and I feel there's so many more suicides now, Steve. What is your take on that? And what do you feel that we're doing about that across the world?
Yeah, I mean, certainly it's not an area I've been particularly involved with. I know colleagues
Mm,
at the RNLI, they've got a real focus on this, and they're working with sort of mental health charities and others to really engage in this issue a bit more because, as you said, a lot of people are using the water as the kind of means for the suicide. It particularly affects certainly in the Western world, it
mhm,
affects men far more than women. But actually, that isn't true when you go to other parts of the world. It actually impacts women far more than men.
mhm,
Um, but yeah, what I don't think we have really is enough data to really understand the
mm,
extent of this problem. Maybe we do in the UK, but certainly more widely we don't. And then understanding what kind of interactions or interventions would hopefully
mm.
prevent that. But this to me is one of those certain situations where you need to go far back upstream to some extent, excuse the pun, in terms of addressing the core issues of
Yeah.
obviously mental health. And water safety does have a role to play there, but it probably plays more role when it gets obviously to the situation
Mm,
where people are considering or near or in the water where they can really have a greater
mm,
impact. And I know there's work going on in places like London where they have sort of
yeah.
wardens on bridges and they have various notices up and phone lines and chaplains and all sorts of things to try and reduce those cases. But I have to say, it's not really an area I'm massively involved in. I would just quickly,
Mm,
before I forget, one of the points you made a few minutes ago around that kind of more interactive kind of classroom session. It
yeah.
just reminded me I was in Uganda in March supporting this program that's funded through the kind of Bloomberg's work there. And they've introducing a school-based kind of lesson-based water safety initiative as well
Mm,
as swimming, but school-based is part of it. And you know, initially it was quite dry. It was very much teacher sort of telling children, you know,
mm,
what to do and what not to do. And when we started that particular into much more kind of interactive, getting the kids up, getting them to sort of do as you say, get sort of old bottles and throwing it to people,
mm,
and you know, they started to laugh and engage. And I think, you know, well, we'll do the research we've done, but the retention of that information would be far greater than just a teacher talking directly to the children. And so
yeah.
seeing that firsthand about the children coming alive and really wanting to get involved. Their hand was shooting up every time a question was asked because they felt they had an opportunity to really interact with the lesson.
Yeah, it was really interesting that, Steve. What's to come for you? What are you doing? What's coming in the future?
Well, at the moment, one of the sort of projects I'm leading on with the International Maritime Rescue Federation is a global review of the entire maritime search and rescue
Wow.
system. So, like everything, and probably like drowning prevention more generally, things have just evolved over the years, but there's never really
Mm,
been a time to kind of stop and look at does the system work and will it
mm,
work as effectively in 10 or 20 years' time, and what do we need to do to change it? So, this review is looking at the entire system from you know, coordination, search and rescue response, education, satellite technology, everything
wow.
else. So we're going around talking to various countries, various stakeholders to see what's working well and not what's not working so well. And the key to us is kind of understanding the kind of external things like climate change, migration, AI, technology, which we can't control as a sector, but we can certainly influence in terms of how we respond to those things.
Mhm.
But also looking at the internal challenges of search and rescue, like funding challenges in parts of the world like Northern Europe. You know, volunteering is becoming more difficult to get volunteers to work on, you know, or respond to incidents. So this we'll be launching the findings and review in about a year's time, and we
Okay.
hope that will become a kind of key moment to then advocating to various policymakers or search and rescue organizations about what they need to do to really adapt. So that's kind of one of the projects I'm involved in. I'm also sort of going off to the World Drowning Prevention Conference next month to talk about some of that work, but also some of the kind of broader stuff that's happening around drowning prevention. And part of that, I'm involved in a flood rescue program, which is an
Wow.
increasingly kind of area of interest because with climate and rising sea levels and floods, there's more need than ever before for having good flood
Oh, yes.
response systems in place
Yeah, I
in all countries, essentially.
can.
And yeah, and then sort of just doing advisory work on various drowning prevention initiatives. So keeping busy, put it that way.
Keeping
So
very busy, Steve. It's amazing, honestly. I mean, it, the work that you've done since I knew you is absolutely incredible, and I'm really proud to know you. Very, very much
oh,
so.
well, likewise. I mean, following your journey, I know we've spoken once or twice since we first met, but to see
Mm.
where you are now and what you're doing and the recognition, not just yourself going with things like the MBE, but also just the kind of awareness of your organization, but more importantly, the awareness of the issue and the work that you're doing is
Thank
definitely
you.
having a huge impact. And your name often gets brought up when I'm talking to people. So
Really?
in a very positive way, I should add.
Hope
So
so.
yeah, so brilliant to see that. And I have to say, I do genuinely remember very much, us meeting because it was quite early on in my career. I'd only been
Mm,
involved for a few years at that point. So I was very much still in learning mode, which I still am now, but particularly back then. So certainly things I've been doing since we've met have been as a direct, consequence of us meeting.
wow. Oh, that's amazing. Don't, I can't cry. I will not cry. Um, Steve, where is the conference this year? The drowning
So
prevention.
it's in Sharm el Sheikh in Egypt.
Oh, that's
It's
the
every
one.
2 years,
Yeah.
and they try to move it to different parts of the world to make sure they can
Mm,
encourage people from all sort of parts of the world to attend. And so this got quite an Africa focus, but it's still very much a global
yes.
conference, and that's been brilliant. So Justin Scar, who I'm sure you've heard of from
Yeah,
Australia,
yeah.
he sort of
Mhm,
coordinates this global conference, and it's really an opportunity to learn and share from others because most
mm,
countries have similar challenges, and actually by coming together, we can sort of see where people are and what they're up to, and then build the good ideas, adapt them for our context, whether it's the
mm.
UK or wherever, and saves a lot of time and a lot of money in terms of that sharing experience.
I actually spoke at this year's UK Drowning Prevention Conference. I was really proud to do that. So I'm going to dangle a little carrot now and say I'd be more than happy to talk to the next one that there might be internationally, if you'd like
Yeah.
me to.
Definitely. And I think getting more voices like yours at these things, there's not just a bunch of practitioners or researchers, and I include myself in in those categories, but people like yourself who can really talk about, first-hand experience and what you're doing. I think
I'd love to,
adds a
really.
huge amount of
Yeah,
value. And
I'd give anything to do that. I would. Yeah.
yeah, and I think conferences are getting better at that because I'm a bit
Mm,
skeptical about conferences. Unless there's a good
mm,
output or outcome from them, it's a bit of a talking shop. But I think more recently there has been a movement to have more voices from those impacted at these
yeah.
places to share their experiences, which then give people the sort of information they really need to then think about how they
Mm,
deliver their work. So I think, yeah, I'm very happy to always mention you and say you'll be a great,
great.
keynote speaker or someone in that environment to
Mm.
talk about your work.
Thank you. I am doing my own next year. It's the 20 years since Chris died next year. So I'm putting on a conference. I've been speaking to Chris
Yeah.
Cousins and the fire service. They're quite well behind it. We're going to do it here in Llandudno. So you might be getting another little invite with a gold ticket to speak. If you're around, I'd love to have you there. I really would. It'd be
Thank you.
wonderful.
And to be honest, any excuse to come back to London now is always a good
No
excuse, but
worries.
particularly for what you're talking about, I would love to come. So yeah, do keep me posted. If I'm around, I'll definitely come.
And we're doing a black tie event later on in the year as well. So yeah,
Wow, thank you.
I'll keep you updated. And anything I've said to everyone, Steve, whatever's coming up next year, because it's 20 years, if anyone wants to use the story, my story and Ras as part of that, then I'm more than happy for anyone to utilise that in the best way possible.
Yeah,
Okay.
no, that'd be great. Thank you.
Yeah.
I'll have a think actually how that might work from the work that I'm doing
Mm,
as well, because some of those
brilliant.
kind of moments just remind people about what we're doing, and it's
Mm.
quite useful to sort of use them as a way to kind of get coverage.
I'm just remembering now, if you may not remember, but when I began, the ROSPA drowning figures were 6 years behind. Haven't we come a long way?
Yeah, yeah,
Haven't
I
we
know.
just?
I remember those conversations about that. I was involved in
Yeah,
the what was called the WAVE database,
that's
and
right.
everybody was reporting completely different figures. And from a kind of advocacy perspective, or even trying to develop program perspective, it was impossible
Mm,
because you couldn't have a serious conversation if we're all saying different things. So
yeah.
having this more sort of collective database of drowning figures,
Mm,
and actually I know that kind of model is now being used in other countries as well. So it's definitely had
yes.
broader benefits than just the UK. But to have that nearly real time information, or at least the
Mhm.
previous year's information, is a game changer when you're having those conversations. So yeah,
It's,
there is some really positive things that happen,
mm,
and perhaps with your the 20-year moment from what happened to Chris, maybe the way to all, I'm sure you've thought about this, but it's talking about, as well as talking about the great progress that's been made in those 20 years, but also some of the kind of ongoing challenges. So it's not all
yeah.
about the sort of challenge, but actually there has been some brilliant progress in those
Mm.
20 years.
It, I might actually, I think I will. I think we'll do a film, and because I've got the ideal gentleman just sitting in the wings there. He's an amazing guy, and he's put this podcast together beautifully. So I think we'll have a chat with Tom. But I think if we do maybe meet up in a couple of weeks when you're not as busy, that'd be lovely. And I am so pleased to speak to you. And I just want to say a huge big thank you for all your support over the years. It's been
Thanks,
wonderful.
Debbie, and
Thank
thank you
you.
for inviting me onto the podcast as well. Good to see you. Thank you.
Thank you. Take care now.
Welcome to Beyond the Surface with me, Debbie Anne Turnbull. Here we dive deeper than the obvious to explore what really keeps our families safe and our minds strong. After losing my only son Chris to drowning, I've dedicated my life to water safety education and helping others heal. With many years of training and personal experience, I'm here to help you navigate your challenges, because the most important truths are found beyond the surface.